families, it's a difficult thing to do. The mental health problems may include psychological, social, or somatic dimensions, which often make it very hard for people to manage their lives and achieve their desired goals. How do they get going, even though things are tough? Well, psychotherapy is aimed at these problems and attempts to solve them via a number of different approaches. We'll find out about those approaches in a short while, but I've been joined by my guests to help us understanding what everything is all about. Psychotherapy. We have Dr. Nelson Ahadome, who is a physiotherapy and public health specialist, and Cathrin Hamacher. She is a psychologist and psychotherapist specialist and mental health advocate from Icon Health System, Germany. Good morning, good morning. How are you?
Good morning.
Fantastic. I'm going to start with you first. Cathrin, what exactly is psychotherapy?
First of all, I would like to thank you for giving me the privileged opportunity to come to your program. Psychotherapy for me means to offer individuals or families or systems of group non-judgmental space to express themselves, their feelings and thoughts, and to assist them in finding their own solution for what they perceive as their problem, or what makes them feel uncomfortable. Yeah.
So you get people to talk about their issues and then look for solutions?
For example, like if a client comes to me, they usually have something that bothers them, like that bothers their minds, their feelings, and they also have usually they have a goal to bring their life in a desired direction they want it to be, and depending on what they define for themselves as their goal, I'm trying to assist them in finding the solution that they want for their problems.
What do you do if the person doesn't want to talk? Because it seems to be centered around conversation.
True. If the person doesn't want to talk, I would first ask what is the motivation for this person to come to the therapy, and maybe depending on which function the person might see in keeping silent for a while, we would see and show what the process brings. Okay. Maybe it's it's a shyness that is there in the beginning, but we could work on that and try to see what is behind that shyness.
Okay. I'm sure you have ways of making people talk. I'm sure you have ways of getting people to open up after a while, I guess.
Yeah, I hope so. Of course, at the beginning, it also is about building up a relationship to your client. Okay. Creating a space in which they feel like they can open up, they feel appreciated, and they feel understood, or also, first of all, respected for at least also coming and seeing someone.
Okay. All right. Thank you. Nelson, I'm curious though. She's a psychologist and a psychotherapist. You're a physiotherapist. What has physiotherapy got to do with psychotherapy?
Okay. First of all, as a public health scientist and also as a physiotherapist, I've really seen a lot of cases that need or that have that component that is associated with mental health. When it comes to even our campaign, with the blood pressure campaign, you realize that a lot of people are going through a lot of pressure, a lot of issues. And out of a myriad of solutions that are available to them, it's difficult sometimes to make a healthy choice, or it's difficult to find a healthy solution sometimes. So some people resort to all sorts of unhealthy lifestyles and choices that affect their health in the long term. So when it comes to physical therapy, it comes to public health, we feel mental health is a key issue. That is why the Icon Health System takes it up as one of its campaigns to create awareness and help to bridge that gap between the individual and finding a solution, a supportive solution it's not decided from us alone, but it's like working with the individual to get a solution that is better for themselves.
And for somebody who just tuned on and he's listening to psychotherapy, he's heard the definition, but he's also hearing another therapy, physiotherapy. What exactly is it? Break it down for that person.
Okay, when we talk about physiotherapy, we are talking about the practice of medicine in relation to solving physical problems. So all approaches that helps to find solution to issues that have to do with the physical health of the person, when it comes to stroke, back pain, and when it comes to improving your lifestyle or improving your body image or improving your well-being. Physiotherapy has modalities that help to solve these issues. Okay, so someone undergoing high blood pressure can exercise or do a few things in physio that will help to improve the person's blood pressure. Someone who is having back pain can receive treatment that will help to improve that back pain. And there are also ways of handling yourself, like the way you sit, the way you drive, and all sort of things that will help to improve your pain in general. And now, when we are talking about pain and all this, we don't have to leave out, since today is for psychotherapy, there's psychological component when it comes to pain management. Okay, in every pain that someone is going through, there is a psychological component. So when the psychological component is addressed, then you can even find more improvement. So physio interrelates also with the psychotherapy to improve a person's well-being. Okay,
when you talked about posture, I just realized I better start sitting well before you start giving me marks. Cathrin,
we are learning.
So tell me, what are the various approaches that you use in psychotherapy?
Okay, there are different approaches. Me, I'm training in systemic family therapy. But there are also other approaches like psychodynamic approaches, psychodynamic therapy, psychoanalysis, cognitive behavior therapy, and then there are also Afro-centered psychotherapeutic approaches. For example, Ubuntu therapy and Mazaron therapy, client-centered cultural therapy, then also culture-centered therapy. Then also harmony restoration therapy, and I read in the Ghanaian Mental Health Journal about NTU therapy. Yes.
What are the most common ones that psychotherapists and people like you use?
Okay. Well, I would say due to the fact I can speak from my perspective, like in Germany, the very dominant approaches are cognitive behavior therapy
and
psychoanalysis. But me, I'm training in systemic therapy, so I'm more focused on that.
So what is that? What is systemic therapy?
Systemic therapy, Systemic therapy is, let us say, a concept of describing observed phenomena in a specific way and manner. Like it's like our understanding of mental health symptoms is that the person who shows mental health symptoms is the person that makes visible that within a system the person moves. May it be a family system, may it be a professional system, or may it be even a political system that is around us, that there are dysfunctional, dysfunctional interaction patterns, or also communication patterns. And this is the thing that we would like to work on. We focus on bringing this dysfunctional patterns to more functional.
Okay, so if I came to your clinic and you were going to use your systemic approach to talk to me about my mental health issues, what kind of questions would you be asking me?
Oh, there could be different questions, very open questions. A very common technique is circularity question.
Okay, give me an example.
Yeah, okay, please give me an example of what would be a issue that you would face, you would come to see me.
Maybe, okay, stress at work.
Stress at work?
Yeah, I feel work is stressful.
Okay.
Waking up too early, sleeping too late. And I think it's affecting my performance.
All right, stress at work. So, what does stress you at your work?
Okay, the fact that I'm not taking enough sleep, and I have to get here very early, and I have to smile even when I'm not feeling like I want to smile because it's television, you know. And when you finish the show, then you can revert to your face that didn't want to smile, you know. So you feel like you have two different personalities. One where you're not happy, but you have to ensure that you're happy, and then when you're down, then you go back to not being happy. That's an example.
All right. So when you think about that on a scale from 1 to 10, how much does it stress you?
Maybe 6.
A 6.
Yeah.
All right.
But I think it's getting too close to 7.
Okay. So, all right. So I could invite you to do a task with me.
Okay.
We could create, for example, an imaginative picture for yourself. All right. So, what do you think? What might be a characteristic that you need in order to face this stressful situation?
Maybe I should sleep earlier.
Okay.
Yeah, because since I can't change the time that I come to work, I can change the time that I go to sleep.
All right.
Yeah, maybe I have to rearrange my life in such a way that I can sleep earlier.
Okay, but something is keeping you busy or avoids you from sleeping early, right?
Okay.
So what would that be that you need? More relaxation or more calmness?
Okay.
What do you think?
So I can see where this is going. So it's quite interesting. Then you get to think about what you're doing, and then you provide your own solutions. Is that correct?
You provide your solution. I'm trying to ask questions that guide you to find your solution. Right. Because we believe that you are the expert of yourself, and we are just assisting you. We are trying to face you, or we want to face you on an eye level. Okay. We want to tease your self-healing abilities and your also self-efficiency.
Okay, let me bring in Nelson. Nelson, do people visit psychotherapists a lot in Ghana? I mean, I must imagine that in Germany it's quite common. Is that correct?
Yeah, it's common, but still we are also trying to improve to make it more accessible for other people and to encourage people to talk about it, because even there it's sometimes stigmatized.
Okay. Yeah. What's the situation in Ghana?
When it comes to Ghana, the people coming for psychotherapy or psychological counseling is not as open as compared to some of the developed countries. Okay, this is because we are still creating the awareness. We are still making people understand that they can talk to someone, they can find solutions to their problems with someone. They don't have to be in their corners and deal with it alone. But currently, when you see the mental health awareness creation done by Dr. Seto Nogbe, who is also collaborating with us, and you see a few other people and the mental health society making a lot of campaign to create the awareness, you realize that some people have started speaking up. Even though till now I would say it's not very much common as at now. People are still trying to do things in their own way. And this is really, really causing a lot of issues. Just a few days ago, like last week, someone committed suicide in the Ebri Garden. Yes. Sorry, it didn't come to your notice, but this has happened last week. and it's a big concern. This person committed suicide because he feels, from what he told the other people, that the economy was so hard.
Oh, wow.
That he could no longer deal with it.
All right.
You see, if this person had, had someone to understand with, to find a better solution, suicide and other things that we do are solutions in themselves. But there are solutions which are better than others. Okay, that is why it's important for us to come up with our issues and find solutions to our issues. If this person had, had the support of a psychotherapist or someone with this practice, it would have maybe saved them from deciding on that solution.
Is psychotherapy on the national? Is it covered by the National Health Insurance?
At the moment, no.
No. So you have to pay.
At the moment, you have to pay for. There are some insurances. There are some private insurances that cover for psychological counseling.
Okay.
But the National Health Insurance, as of now, doesn't cover this. Okay. And we hope that as the government and the political system is seeing the importance of it, which Icon Health is also trying to promote, we hope that with time it can be part of the things that it covers.
Yeah, because I can imagine with COVID and then the economic downturn, people are getting very stressed, and they probably need to be speaking with people. Yeah. Before I come to Cathrin, how much is an average session, and is there a price range, and then how long do psychotherapy sessions last for?
Okay, when it comes to Icon Health, our clinic is now incorporating this therapy, so we are not charging much for it. Okay, as at now, psychotherapy in Icon Health Clinic is for free. And a session could last from 50 to an hour. 50
minutes to an hour?
Yes.
How many times a week?
Oh, depends on the condition that you are facing. When, like we said, when it comes to something like blood pressure or depression or stress, which has been covered in our book, which is the blood pressure book that we introduced here before, there are things that we will guide you to, and then we will even recommend you to go and read further in the book. Okay, and it could be supportive to you. So it depends on your condition. If you have pain, if you have blood pressure, if you are going through stress, if you are going through depression, if you have different, maybe you are dealing with alcohol, you are dealing with sexual abuse, you are dealing with a heartbreak or something, it depends on what you are dealing with. Okay. Then
the sessions depend on that.
Yes.
Let's come to Cathrin now. So, what's the situation like in Germany, where you're more familiar with? I mean, is psychotherapy part of your National Health Insurance?
Yes.
It is?
Yes, okay. It is. In Germany, we have the opportunity that to see a psychotherapist for 5 probatory sessions each term. And
each
then
year?
You said?
Each year?
Each term.
What is the term?
The year has 12 months.
Okay.
The 4 terms.
Okay. All right.
Yes.
Okay. So every quarter you can see a
quarter.
For 5 sessions.
Probatory sessions.
All right. Okay.
So
everybody in the country can do that.
Can do that, but not everyone would do that.
Yeah, of course. But it's there. The facility is there.
It's there.
Okay.
It's covered by the insurance. And then there's the opportunity to have, for example, to decide after these 5 probatory sessions, is that enough, or do I want to go for further therapy?
Okay.
Right. So then you get 12 units, then another 12 units if you see further need, and then up to 60 units. But then you can also, there are certain approaches which offer even more units, because they have another approach, like the psychoanalysis would handle it a bit different.
Right.
But so it's there. Yeah.
That's the important thing. It's there. We've got about 4 minutes to wrap this conversation up. What do you want people to take away from this conversation, Nelson, concerning psychotherapy? And then I'll come to you, Cathrin.
Okay. My empowerment to all of us is that when we are dealing with issues, we should not just keep it to ourselves. We should be free to open up to the right professionals. I know in Ghana, pastors and other people are doing a lot to support the system, but they should also seek for professional care. And when you seek for professional care, it's going to be easier to guide you to find solutions and not just pray about something and keep in your corner. And also, our blood pressure book, which is an aid to resilient health, has an approach which is part of the psychological approaches that will empower you, help you to, overcome stress and overcome issues of high blood pressure and making right decisions when it comes to healthy lifestyles. So I encourage you, come to the Icon Health Clinic at Taifa, and then just opposite Poku Pharma. And then you can access Cathrin also, who is here with us for a period of time. And then you will be able to, find solutions together with us. On the 4th of February, we're having an open day clinic, which is quite free. We have a lot of health screening and psychological counseling. Psychotherapy will be there, and physio will be there. All sort of health professionals will be there to offer you free services at our clinic, at the Icon Health Clinic at Taifa, opposite Poku Pharma. We hope to see you. Thank you.
Thank you very much, Nelson. Cathrin, what's your last words concerning psychotherapy and the need for it?
All right. I think one aspect that I didn't talk about yet is that I see even behaviors that might be considered as symptoms for mental health issues as tries to cope with something. So what I would like to empower is that we start to ask ourselves, what I am doing, what are we doing? Why do I do that? And if I don't have an answer to it, try to reach out to people or to psychotherapy. Let's think about what might be the function of this behavior. What is behind that? Okay. Let us go to that and let us see what can be changed. And also encourage to involve other social and personal resources, like the family, like the community. You have beautiful communities here, and also in in my home country, we have beautiful communities. So let's see how can we bring the life of individuals and also families and systems in a better way, and to improve understanding for each other by exchanging perspectives, and trying to consider the mental health also as an important component in our life.
All right. Thank you very much, Cathrin Hamacher. She's a psychologist and psychotherapist specialist and mental health advocate, Icon Health System, Germany. Dr. Nelson Ahadome is a physiotherapy and public health specialist, and we'll be talking about psychotherapy. You can get this same conversation, it'll be on Facebook. Go to GTV Ghana. And tonight, for those of you who don't sleep early, 11:30 p.m., you can watch this show all over again. Thank you so much. Enjoy your day.